Hi, everyone. Welcome to the SAEM Research and Learning Series course online lecture titled, How Little I Know, Opportunities to Expand Research Methodology Education. And now it is my pleasure to introduce to you Dr. Joseph Miller. Dr. Miller is a clinical associate professor of emergency medicine and internal medicine at Henry Ford Hospital and Wayne State University. He completed his medical school at Indiana University School of Medicine and residency at Henry Ford Hospital's combined emergency medicine and internal medicine program. After completion of an internal K award, he has been active in clinical research with a focus on cardiovascular disease. He oversees the SAEM ARMED course, which will be mentioned in this webinar. Dr. Miller, I will now turn it over to you.
All right. Thank you, John, and welcome everyone. I'm so happy you can listen into this webinar. And I especially invite anyone that's earlier in their research career, whether you're a student, resident, junior faculty, or even further along, but want to delve more into research. I encourage you to think about some of the things I'll present and encourage you on your path forward. So really what I want to do is I want to describe some opportunities within SAEM and that could help you expand your knowledge of research methods, but then also look at additional ways beyond the typical webinars and online learning opportunities you may have in front of you that could really boost your ability to do great innovative research within emergency medicine. So one way to think about this is that we all have certain toolboxes we come to our jobs with. When you were learning how to become an expert at airway management, you put together your toolbox of adjuncts like a bougie and your glide scope, etc. Well, same goes for research. If you want to do excellent research that's going to make a difference in emergency care, you really have to build the right toolbox to do so. And I remember when I came in as a junior faculty, my toolbox was this little thing that, maybe I used as a kid to haul around just a hammer and a screwdriver. But over time, I sought additional training to try to create a much broader toolbox. And I still go to additional training to widen my toolbox. And so let's talk about how you can really jumpstart into making that happen. One way to think about research is that a lot of this is really just learning a totally new language and way of thinking about emergency care. And when I started and was thinking about a career in research, I realized that I had such poor preparation during my medical school training and even my residency training to learn this language of research and understand how to put together protocols, how to really think rigorously about methodology and data collection, and particularly around statistical analysis. My understanding of statistics was fairly abysmal when I started as a new faculty. And so I recognize in myself a huge need to really have to learn that language if I was going to make this a serious component of my career, beyond what I could just pick up in journal club, etc. I recognize this in myself, and I think the data out there confirms it, that if you look at everyone that signs into some of the Harvard online learning courses that are free, or the MIT learning courses, whether it's on statistics or anything else out there, less than 5% of people actually complete that training. And that was true for myself as well. I remember as a junior faculty trying to do an online course on simple statistics, and my motivation to actually complete it, other than going through 30 or 60 minutes of the webinars, was pretty poor. So I was dabbling in research, but realized that I really needed to learn this language of grant writing and learning analysis and thinking about all the things that would really allow me to do high quality research and not just dabble in it. So, but why is the motivation to do this? I think I'll bring up a few things that there's been some great publications recently about why we need people like you to do more than just dabble in research, but really jump fully in and get the right toolbox and the right toolkit to do high quality research. The main issue is that, we would really have a mission as a medical specialty to improve the lives of our patients through innovation and research. And that is a huge motivation that should drive all of us to do this. I mean, one example that occurred to me recently, partly because I've become involved in pancreatitis research, is that acute pancreatitis is an emergency condition that has had no disease-modifying treatments or drugs being tested for it or other innovations being tested for it for decades. And so that's just one example of many where there are areas in our emergency care that have a huge impact on patient lives, but innovation is not happening. And we need people to jump in and do that innovation. And we also have an obligation to our learners and to our colleagues to also do innovative research to improve our educational work, as well as to improve the wellness of our colleagues and the processes within our emergency departments. I really love this quote that Judd Hollander has, and this is on the SAM website, but Judd is chair at Jefferson. He has this quote: "You cannot be successful at anything in life without the requisite skill set. You train to earn the privilege of treating patients. You train to learn how to apply your emergency care skills to anyone with any disease who rolls through your ED door. What makes you think you can learn to do research without being trained? Find a mentor, learn the skills required, and then an employer or funding agency is much more likely to see the value you bring to the table. You might get lucky without training, but odds are against you." I think that certainly holds true. Now, if you look at where emergency medicine stands in the bigger world of medical research, one way to look at that is to simply analyze our percent of funding from the NIH relative to other specialties. And so here's one graph. This is from a publication by Roger Lewis in 2018 in the Annals of Emergency Medicine, that showed that if you look at overall funding, emergency medicine is the bottom of the barrel in terms of percent of total faculty that are funded. That remains true today. This was from a publication that just came out this month in Academic Emergency Medicine, highlighting that if you look at all medical school faculty, only 1.7% of emergency medicine faculty that are at medical schools are NIH funded as principal investigators. And then only 33% of medical school departments of emergency medicine have an NIH funded PI. This puts us also at the bottom of the list of all medical specialties that have affiliations with medical schools. Now, as bad as that sounds, the good news is that there is improvement. So if you look at NIH funding since the 90s up to 2018, and this is from a 2018 article I just referenced, that we've had a substantial increase in the number of NIH-funded projects attributed to emergency medicine faculty. This number was less than 20 approximately in 2005, and it was up to 120 by 2018, and this year is even higher than that. And this kind of funding is driving game-changing, innovative research that is being published in major journals. This is one very recent example from Fred Corley out of the University of Michigan, who is an amazing investigator that received funding along with Cliff Calloway and the Siren Network to do a trial of early convalescent plasma for high-risk outpatients with COVID-19. The study was completed in extremely expeditious fashion and recently published in the New England Journal. And so I encourage all of you, as you're thinking about research careers and thinking about why should I get motivated to do additional training, I encourage you to read this article by Bob Newmar and company that really looked at strategic goals for our specialty over the remainder of this decade. One of those goals is that by 2030, that we will have 150 emergency medicine faculty at medical schools who are PIs of NIH-funded work, and that our total federal funding will exceed $100 million. And I hope that you can be part of this trend to really jumpstart your careers to enter into that challenge. So jump in, and I hope you can ride the tide as it continues to rise. So personally, when I first started in emergency medicine, I was working in education, working in research, and I saw that my toolbox was pretty empty. I saw that a hammer and a screwdriver wasn't going to be enough. Realized that my understanding of statistical language was poor at best. And so I sought additional help from my chair to look at opportunities to improve my understanding of research methodology and statistics. And so my chair at the time was generous and was willing to pay for me to do a master's course funded through the department that occurred at the University of Michigan. It really allowed me to get the skill sets that were needed to be further involved in research. The other thing that my chair helped create was really put me in touch with the right team to both mentor and collaborate with during this journey. So trying to do a research career solo without appropriate mentorship, without a team next to you, can be very challenging. And sometimes that may mean that if you're at a location where you have poor access to team members to do strong emergency research, if you really want to make this a focus of your career, you may have to consider changing institutions to a place that will accommodate the right team or has the right team and can build the right team to support you. And these are a few teams that are out there in emergency research. The bottom right is a team led by Mike Danino at Beth Israel that has a long track record of NIH funding and has done amazing work. We also have a team from Vanderbilt, Duke, and others that continue to innovate in emergency care and bring in NIH funding. Another key aspect of the team is really having mentorship early in your career. And so I was fortunate to identify a few mentors within my institution that were part of my team. One of them was Phil Levy, who had a history of NIH funding and is at Wayne State University and currently a vice dean of research. And then also Chris Lewandowski, who is dressed like a pirate here, who also had a long history of neurological emergency research and a close friend, was very instrumental in my early career in terms of appropriate mentorship and guiding me on making the right decisions and looking for the right opportunities. We could go on and on for an entire talk about mentorship, and I know there's more within this RLS series on that. But let's jump in and really talk more about what kind of additional training there is besides the webinars and online resources that you may have run across. The first thing I'll mention, and as a caveat, I am a course director for this, but I certainly want you all to consider ARMED, which is the Advanced Research Methodology Evaluation and Design course that is put on by SAM. This is a approximately 8 to 9 month course. It goes through the academic year from September to May. It begins in September, ends at the annual meeting in May. And it has a focus on basic research methodology, grant writing, mentorship. We try to really encourage the participants to be paired with mentors and also gain mentorship through the ongoing coursework and workshops that we do. And is deeply connected to the EM research community. It is run by SAM and is the research committee within SAM has deep involvement. Furthermore, it's also tied to an exclusive $25,000 grant to fund a project from alumni that have done the course. So a lot of incentive within there. And the course often has multiple in-person and web-based components. The in-person components occur at ACEP, at a winter workshop at SAM headquarters, and at the annual meeting. And then we do virtual or online or virtual components in between, whether it be a mix of webinars or virtual meetings with other collaborators in the group. And so it does have certain metrics that are followed over time, and we really push the participants to make progress along both learning the methodology and then coming up with grant ideas over the course of the year. Started soon after ARMED was ARM Med Ed, which is led by Wendy Coates and others. and is an amazing opportunity for those that have a particular interest in medical education research. And so this is a longer cycle, approximately 16-month cycle of participation. And it also is connecting people to methodology, to mentorship, to grant writing, and connecting you to the EM research community along medical education. So it too is an amazing opportunity to jumpstart a research career. Both this and ARMED are a heavy lift. They involve monthly contact and numerous workshops that occur either over 8 or 16 months. However, they're a good balance of what you can do while working full-time clinically that is a little short of some of the other things that I'll mention in a minute that may be even more time-consuming. Now, again, I think online learning has a lot of limitations. If it's purely online learning without any kind of goals, objectives, and tracked outcome assessments, and you don't have people that are really holding you accountable for making progress in your learning. However, I will at least mention that the NIH has recently made their kind of full cycle of research methodology learning available for free to anyone. This includes multiple modules that are meant to be done over a course of 6 to 9 months and include tests with them to kind of track your progress and track how much you're gaining from the education. So it's certainly a good option brought to you by the NIH. But if you're like me, having the accountability of being in a course with other participants, whether that's virtual or in person, is a huge benefit to actually really dive in and getting these things done. Here's some other examples of shorter courses sponsored by the NIH that may be beneficial for you, particularly if your research interest in a particular area. One, there's courses on clinical trials related to behavioral interventions, which many people in emergency medicine are doing research in. Also, NIA, National Institute of Aging, puts on a boot camp for people interested in delirium research. And these are NIH funded. NINDS, which focuses on neurological emergency, has a clinical trials course to teach methodology that occurs over a year and is led by emergency physicians, including Will Moyer at the University of Michigan and Roger Lewis at Harvard or UCLA. I did that course when I was first starting and getting my feet wet in neurological research and clinical trials, and thought it was an amazing opportunity. And that opportunity continues as that team has continued to get funding from the NIH to do that. And there are more of those opportunities out there that come and go over time, whether it's through the NIH, whether it's through foundation, whether it's specific to emergency medicine, or could be within another specialty, but could be extremely beneficial to the area of research you're in. And the next thing is I really want to talk about formal degrees and the kind of rigor that these can bring to both your understanding of research, your ability to design research and carry it out, and also your ability to get funding by showing that you have, the chops to do what you want to do. So this was a quote from Schaefer, who wrote an article about the vanishing physician scientist, a book called The Vanishing Physician Scientist, and put in that projects that are totally safe have less chance of making a big difference than projects with a distinct chance of failure. You could say the same is true for training. By doing formal degrees, it's less safe, there's a bigger time commitment, but your chance for failure in a research career, I think, is going to go down quite a bit. So there are all sorts of different degrees that emergency physicians do to advance their research training in a formal manner. Sometimes people come in to a research career having done this before medical school or during medical school, occasionally during residency. But these can involve both masters in science, masters in public health, so an MPH degree is very common, or even a PhD. And many emergency physicians certainly come in with a PhD into their by doing an MD PhD program, but others have gone back and gotten a PhD when they realized that the methodological learning they needed would be best served in that way. Many of these programs are flexible and becoming more flexible as people have gotten extremely used to virtual learning. But I encourage you to consider these at rigorous institutions that will provide you with outstanding learning and not necessarily go for the cheapest or most accessible virtual program. Because there are some extremely accessible MPH programs, but their rigor and education may be lacking compared to more well-known programs such as the Hopkins programs, Johns Hopkins programs, or others by really good institutions. Many of these are also available through your local medical school or health system in terms of, being able to get tuition discounts or support from chairs like I did. Now, often the master's in science degrees will be a little bit heavier on methodology or quantitative methodology, particularly in terms of statistics, whereas MPHs can have broader reaches, whether it be into health policy or focuses on epidemiology, population health, or potentially a more biostatistical centered MPH program. So I encourage you to ask around for other communities, for other members within SAM to see what they did and find the best fit for you. Now, the one I did was called the Clinical Research Design Statistical Analysis Program, which is offered by the University of Michigan School of Public Health. It's very, very much tailored to junior faculty, particularly graduates, particularly junior medical faculty. And people would come in from all over the country to do it, although most were from Michigan. People would fly in for 3 or 4 day weekends once a month, where all the on-site education happened. And then some education happened virtually as well. So it's really tailored for kind of on-the-job training for people that don't necessarily have 50% of their FTE devoted to research learning. Now, if you're finishing your residency, or maybe you're also junior faculty and considering a research career, I also strongly encourage consideration for research fellowship. While this can be a pay cut for a short time, the long-term benefits of getting that concentrated training, concentrated mentorship, potentially often tied to concentration degree, whether it be an MPH or a master's in science degree, that concentrated work can have huge benefits for your long-term trajectory in research. And so this is a map from the SAM website showing where the current research fellowships are available. And there are more, but this is the core ones approved by SAM. And so these are wonderful opportunities to look into additional training, whether it's 1 or 2 years or more. And I recently heard of someone that was 5 years in her career who decided to go back and do a research fellowship and take that pay cut for a short time because she realized that getting that additional mentorship and methodology was critical for her to really have the long-term impact that she hopes to have on innovation and changing the way we manage our patients in emergency medicine. This was recently announced as an example out of Jefferson. Kristen Rising and Anne-Marie Chang and others recently received funding to run a T32 program, which is a NIH-sponsored fellowship that really focuses on telehealth, mental health, and addiction. And so that's just starting this year and an opportunity for emergency medicine residents or junior staff to apply for. And there are other similar programs around the country. We can't cover all of them, but through the communities within SAM, there are people that we can put you in touch with all the right fellowship directors to get you established in such a pathway, which can be a great way to go. I'll just kind of put this in the framework of kind of NIH trajectory for funding. So ultimately, most people that want to do innovative emergency care research may need funding or may want to be particularly look for federal funding to do that. And so one common pathway to do that is applying for K awards, which are career development awards that allow you to have the mentored time and space within your academic position to work toward research and to learn additional methodology to push your career forward. And so many people on their road to be an independent investigator and make big changes in how we deliver care to our patients may apply for K awards. And those K awards could include plans, for instance, to do additional methodology training, whether it's an NIH-sponsored course or potentially whether it's an advanced degree, such as a master's in science degree. So those degrees could be part of a mentored career development plan that is submitted as part of a K award. So to conclude, I hope you all will think of solid, really concrete ways that you can build your toolbox and join the pipeline of investigators that are going to make a huge difference for our patients. Finding mentors is a big part of that, and putting yourself in a place where you have the right mentors, the right team is critical. That is getting easier as we move to a virtual world. So think about investing in yourself substantially over these next few years, and I hope that you too will join us in really changing and innovating emergency care for the betterment of our patients. So thank you, everyone, and please reach out anytime. I'd love to help you in your journey.
Okay, well, thank you, Dr. Miller, for this very informative presentation, and thank you to everyone watching this presentation for the SAEM Research Learning Series. Have a great day.